All right, let's talk about thyroid conditions. Hypothyroidism is one of the most common thyroid disorders characterized by a number of symptoms. This can include brain fog or mental decline, depression, dementia, weight gain, constipation, dry skin, hair loss, cold intolerance, or thermoregulation issues. You could develop a hoarse voice, irregular menstruation, infertility, muscle stiffness and pain, and a shit ton of other symptoms that I'll just refrain from listing. The point is, optimizing thyroid function is crucial for overall health and longevity because every single cell in the body has receptors for thyroid hormone. So it's suffice it to say, if you have low thyroid hormones, every single cell in the body is going to be impacted. And of course, this could result in many downstream symptoms. Now, the two major causes of thyroid disorders are number one, nutrient deficiency. This could be things like B vitamins, magnesium, iodine, zinc, and or selenium. Iron deficiency is also a major one, or iron overload. And then the second most common cause of hypothyroidism is autoimmune disease itself. The most common cause or autoimmune cause of thyroid problems is going to be Hashimoto's disease. But again, this is simply the diagnosis, right? So more important is to look for the cause of the cause. In other words, Hashimoto's is simply a diagnosis. That's all it is. It's a label. The question should be, what is causing your Hashimoto's to develop? That is what we want to figure out. And if autoimmunity is causing the problem, the main idea here is really figuring out what's causing an imbalance in your immune system. So balancing and regulating the immune system, slowing or stopping its attack against the thyroid gland should really be the primary goal of treatment. You don't want to treat Hashimoto's, you want to treat the dysfunctions that are underlying it. Likewise, if nutritional deficiency is the cause of a thyroid problem, then restoring nutrient levels is the most logical first step. Now, all that said, there may or may not be a need for replacement thyroid hormone, but optimizing thyroid function by correcting nutrient balance and balancing the immune system will often significantly reduce the dose that's required to normalize thyroid function, even if you're doing medications. So with respect to diet, there are four primary concerns or things to be thinking about. Number one, there are certain foods that can increase the need for certain nutrients, such as iodine, or certain foods that you could be consuming that actually in abundance are known to damage the thyroid because it results in a deficiency of certain nutrients. Number two, consumption of foods that potentially trigger an autoimmune response. And the most common foods that trigger autoimmunity are going to include things like corn, soy, gluten, and dairy. But we also need to consider things like a high sodium diet, so a lot of salt relative to your other minerals, or people who take large amounts of iodine, or even legumes, nuts and seeds. These are known to trigger autoimmunity. And again, some people are more sensitive to these foods than others. So it's very important to figure that out. Number three, very low carb diets will absolutely result in a decrease of thyroid function. In fact, very low carb diets can tank your thyroid hormones. Finally, assessing and fixing the gut would be very important when it comes to both addressing nutrient deficiencies as well as autoimmune issues. There's just this strong connection between gut health and thyroid function. In fact, 70 to 80% of the immune cells in the body reside actually within the gut. And intestinal bacteria assist in the conversion of T4 to T3. So T4, just to let you know, T4 is the amount of thyroid hormone your body is producing, whereas T3 is the biologically active form of that hormone. That's actually what stimulates your tissues. And this is why it's important to be measuring these. Now, inflammation in the gut can increase cortisol, which then has the result of reducing the conversion of T4 to T3. Other factors to consider would be things like low stomach acid, small intestinal bacterial overgrowth, or chronic infections, whether those are parasitic, fungal, or bacterial. All of these things within the gut can contribute to inflammation as well as leaky gut. And again, this can either exacerbate or trigger autoimmunity, specifically autoimmune thyroid disease. It's also important to recognize that there are patterns of thyroid issues that won't necessarily show up on standard lab testing. The most common is going to include something like hypothyroidism caused by pituitary dysfunction. So measuring PTH hormone, parathyroid hormone is very important for that. Or let's just say in the instance of when inflammation is really high. And again, that can block the ability to convert T4 to T3. So making sure that you're actually measuring markers of inflammation, such as HSCRP or TNF alpha or interleukin, so various cytokines. Hypothyroidism can also be caused by decreased thyroid binding globulin, TBG. This pattern usually involves an inability to clear excess estrogen, or it has to do with testosterone metabolism issues. So you want to make sure that you're also looking at those markers. So again, it's important to make sure that you're monitoring all of these different systems, and these are all systems that can influence thyroid physiology. So you don't want to just pay attention to thyroid hormones, but all the other markers that give you an idea of what could actually be happening within the body. With respect to dialing in on a potential cause or imbalance of thyroid dysfunctions, I'd absolutely recommend starting off with comprehensive blood chemistry testing. And again, this might include a focus with thyroid markers. So you want to look at TSH, free and total T4, free and total T3. You're going to want to measure reverse T3. Like I said, antibodies, so TPO and TG, and also TGI. And then you may also want to look at pituitary thyroid hormone, PTH. I would also very much, as part of a blood chemistry panel, consider inflammatory markers, nutrient markers, metabolic markers, your lipids, a full iron panel, specifically ferritin. So all of these are very important when it comes to doing a workup for thyroid function. On top of that, there's functional tests that you'd also want to consider. This could include things like HPA axis assessment, so comprehensive stress and sex hormone study, organic acid study to look at nutrient balance, food sensitivity testing, because again, that could be related back to autoimmunity. And then finally, there are instances where certain environmental toxins, such as heavy metals or glyphosate. So you might want to look at some testing for that to see if there's anything there that could be influencing your metabolism. Again, this is a quick video that I wanted to make to help you to understand a little bit more about thyroid dysfunctions. I hope that it helps you in some way.